they just cannot afford anything after their kidneys fail completely. Now there seems to be some risk for Indians to get kidney disease. This was a study way back in 2001 where they showed that Indians staying in London have more risk of developing kidney disease than the Caucasians, than the British. So this was a very elegant study which was done 2-3 times in Netherlands, United Kingdom, and so on. And it shows that the Indian population probably have smaller glomeruli and they are at more risk of developing kidney disease. So we should be more aggressive in preventing kidney disease in our patients. Now there seems to be a familial aggregation too, because this is a study which we published in 1999 where we showed that if you have a sibling with diabetic nephropathy and a sibling without diabetic nephropathy, about 33% have a familial aggregation compared to 0 among the siblings who do not have nephropathy. And we looked at this particular gene called the ACE gene, polymorphism of chromosome 17, along with Dr. Kumar Sharma, who was at that time working in the Thomas Jefferson University in Philadelphia. And we were able to show that there is a definite association of the ACE gene polymorphism and diabetic nephropathy in South Indians. And along with one of our PhD students, Priyanka, we looked at patients who had no albumin to start with over 12 years who develops albuminuria and compare them against people who do not develop albuminuria. And we found that the baseline hemoglobin A1C, the mean hemoglobin A1C over 12 years, the presence of retinopathy, triglyceride, systolic blood pressure were very important factors in the development of kidney disease compared to patients who do not develop kidney disease. Moving on to the last 4 minutes about diabetic foot. I think, as Dr. Sharad Pensay said, many of our patients lose their legs, and this was, as Sharad Pensay said, one of the drivers in a bus, the transport run by the government of Tamil Nadu. He lost his leg, he lost his money, he lost his job. So this is what is happening, as Sharad Pensay rightly told you. And along with colleagues from Germany and Tanzania, we have the hospital in Chennai has developed a document which will be released by Eva Feldman now. Yesterday it was released by Andrew Bolton. Today it will be released. This document talks about the prerequisite of examining the feet with very, very simple instruments like the tuning fork and the knee hammer, the ankle jerk hammer, and no equipment which is connected into the power supply, as you heard from Professor Andrew and from Eva in the morning. We don't need any of those equipments in India. All that you need is a tuning fork and things like that. So this document, which is going to be released today, talks about very, very simple methods of diagnosing kidney disease and foot problems, complications in rural areas of India. And this is probably the first time a document has been released for rural doctors, because all the guidelines which we have from RSSDI and API and all that talks about, again, they just copy and paste the American guidelines. So the American guidelines are good, not that I'm saying American guidelines do talk about biotis either, but this is absolutely rural based. And I've had the inputs from all these experts as far as these guidelines are concerned, this document is concerned, and that's going to be released now. Thank you for your...
But globally, and you've heard the remarkable work that Vijay has been leading up across this country, the step-by-step program, setting up foot care, and now looking at the really important and dangerous combination of neuropathy and nephropathy in the diabetes renal foot, which we and others have shown is probably the highest risk group of all for foot problems, those on dialysis. So we look back to the origins of this wonderful centre here in Chennai and Mohan Centre as well, and really remember the wonderful, inspiring work by a pioneer of diabetes in this country in the last century, Professor Vishwanathan. And in his memory, we thank him. This wonderful meeting, and I hope that you come away from this meeting a little more knowledgeable than when you arrived. So, Nandri.